Newborn screening is important to me because it saved our son Grant's life. I think it's hard for me now to think about what his life would be like had it not been for his newborn screening diagnosis. So since Grant was diagnosed with Pompe disease with newborn screening, he was able to start treatment before he ever had a symptom of the disease. Had he not had newborn screening, we would have gone on kind of a diagnostic journey to figure out what was wrong with him, and he would not be the kid that he is today. So I'm the mom of 2 boys, and before Connor was born, I knew that newborn screening was something that happened in the hospital. It wasn't really something that was discussed prenatally, and then we went and we had Grant, and kind of the same thing. Nothing was really discussed other than newborn screening happens. I didn't know what it screened for. I had no idea that it was screening for conditions that would be treatable. So yeah, didn't know anything about it, and since then I've learned a whole lot. When Grant was 10 days old, we got a phone call that something was abnormal on his newborn screen and he had been flagged for Pompe disease. And at the time, we had no idea what that was, but newborn screening was what gave him that diagnosis. So that dried blood spot that they do in the hospital is what diagnosed him. With Grant's diagnosis, he has the severe form of Pompe disease. So he has infantile Pompe, which would have started affecting him in the first few months of life. So had he not been diagnosed early, he would have, been a failure to thrive. He would have had an enlarged heart, issues feeding. He would have appeared floppy, and just really wouldn't have known what was wrong. So since he was able to be diagnosed early and treated early, he's doing well. So Grant receives a weekly infusion every week of enzyme replacement therapy at Riley, and because of that, he is a wild and thriving 3-year-old now. I think it's really important for families to kind of know all of the conditions that are on newborn screening and that it's screening for things that are going to be treatable. So if you do get a phone call that something has come up on newborn screening, it's very important to follow up on that. It might not always be that it is going to be a positive result. It could be a false positive, but you want to make sure if you get that phone call that you follow up because it will be something that is treatable and will make the difference in your child's life.